Basically, there are different types of pain you can experience during intercourse, right? You can experience pain during penetration, so when your partner is just penetrating you initially, or you can experience pain after penetration, so during thrusting, so that one is deep pain. What's up, beautiful people? Welcome to another exciting episode of Pillow Talk with Dr. O. You already know. So today we're talking about something very important, a topic that everyone talks about. I get a lot of emails, I get a lot of DMs, I get a lot of questions about it, and even some people are even shy to talk about it, right? It's painful intercourse, right? Like, let me say it this way: sex is meant to be enjoyed and not endured. So if you're enduring sexual intercourse, then there's something wrong somewhere. And one of the reasons why people endure intercourse is when they feel pain, okay? So sexual intercourse is not supposed to be painful at all. If you're feeling pain during intercourse, then there's something wrong. You need to get checked by a doctor. So today we're going to be talking about 5 reasons why you might be experiencing pain during sexual intercourse, okay? And number 1 reason why people experience pain during sexual intercourse, specifically women. Basically, there are different types of pain you can experience during intercourse, right? You can experience pain during penetration, so when your partner is just penetrating you initially, that can be painful. Or you can experience pain after penetration, so during thrusting, so that one is deep pain, right? So there are 2 different types of pain. Some of the pain you feel it at the entrance, while some of the pain you feel it deep down in your abdomen, right? So I'm going to be discussing the different things that could cause you pain, right, and why. So now let's talk about the number 1 reason. Number 1 reason why people feel pain is vaginal dryness, right? And this normally happens to a lot of women. It could happen during menopause, obviously, because your body is producing less estrogen, right? And that area is more dry than usual. It could happen during breastfeeding or just after childbirth, right? You can experience dryness for the same reason. So this is a common problem that women face, but not only breastfeeding mothers, people that just gave birth, or menopausal women experience it. Even normal women, if you are not turned on properly, if your partner doesn't take time to focus on foreplay and make sure that you are turned on, right, and you are properly lubricated and you are ready to go, then you experience vaginal dryness, and penetration will be really painful for you because it will cause friction and it can even cause you bruises and cuts and all that. So trust me, you don't want to go there. If you're experiencing this, then you might not want to talk to your partner and let your partner know that, see, I need time, okay? I need you to put me in the mood properly. You need to invest time, okay, in things that are going to put me in the mood, so that I'll start experiencing dryness and you won't be the only one enjoying it. We will enjoy it because I won't feel pain anymore. And some of the things that you can do to help this vaginal dryness, they're lubricants, okay? They're lubricants that you can get in the shop. And don't worry, lubricants are used for that thing, so people won't be looking at you somehow like, oh, what's this person using lubricant for? And even if they are, what's their business, okay? So anyway, you can get lubricants, but take note when you're buying lubricants, buy water-based lubricants and not oil-based lubricants, because for example, if you're using a condom, oil-based lubricants tend to weaken the condom wall and destroy the condom, so eventually it leads to tears in condom and you're not being protected. Then for people that are trying to conceive, oil-based lubricants can be harmful for the sperm, and even sometimes saliva, because of the acid and everything inside, it changes the pH balance of the environment needed for the sperm to be able to swim freely and all that. So saliva can actually be a harmful lubricant for sperm for those that are trying to conceive. If you're not trying to conceive, then you might not be too bothered about saliva or no saliva because you're just having fun. If you are not trying to prevent pregnancy using a condom, you might not be too bothered about oil or no oil based, but to be on the safe side, it's just best to use water-based lubricant. And an example of water-based lubricant that you can find in any pharmacy is called the KY jelly. It's available all over the world in any pharmacy, and it's pretty affordable. So if you're experiencing vaginal dryness, that can also help, especially for menopausal women where it's not that their partner probably didn't try all they could, but because of, you know, age is just happening to them, right? So they can benefit from using water-based lubricants. The second reason why people experience pain during intercourse is infections. So the most popular one is something called pelvic inflammatory disease, right? So any genital tract infections, okay, especially those that lead to pelvic inflammatory disease, can lead to painful intercourse. And the type of pain you usually experience in this instance is deep pain. So pain after penetration, pain during thrusting, so you feel it like deep down in your abdomen and it's really painful. So in that case, if you are experiencing pain, you might want to get checked by a doctor because you might have an infection, right? And worse still, something like PID can actually cause scarring to your fallopian tubes. So assuming like you hope to give birth later or something, it could actually cause you to be infertile because it could lead to tubal blockage if there is scarring. So you don't want that to happen. So if you suspect that you have an infection, make sure you go see a doctor to get treated immediately. Another reason why you might be experiencing deep pain is if you have something like endometriosis or uterine fibroids. That can make you have deep pain during thrusting, during intercourse. Again, that's something that you want to have checked with your doctor, so we're sure that the fibroids is not affecting you in any way and the endometriosis is not, causing you any other problems or complications besides painful intercourse. Besides, the fact that it's even causing you pain during intercourse means that it needs to be addressed, so go see a doctor about it. Another reason why you might be experiencing pain during sexual intercourse is something that we call vaginismus. I have a full video where I focus on just that topic and talk about it, so you might want to look at that in the Pillow Talk playlist, okay, or I'll link it down below or in the end screen. But just in case they're not there, make sure you look at it. You really need to watch it. So vaginismus is like the involuntary contracting of your vaginal wall muscles, right? So basically you're not the one doing it. There's nothing you're doing. Involuntary means you have no control over it. Your body, your muscles, they're just contracting to squeeze, right? They're just squeezing on their own by themselves. Nobody send them work. They're just squeezing, right? And it's not you that is doing it. Remember, I said you have no control over it, so you can't really stop it on your own, except certain treatments are applied, which is why it's causing the vaginismus video, so you need to go and watch it. So basically, this involuntary contraction or squeezing of these muscles makes intercourse painful. So basically it makes penetration painful. Not only will you feel pain when your partner penetrates you, but even if you try to insert a tampon, even if they try to put like a vaginal speculum to examine you when you go to the doctor's office, all those things will be painful because the muscle is contracting on its own. So if you're experiencing this, please don't feel shy about it, because a lot of women feel shy about it. It's part of the reasons why some people get married and they're not able to have sexual intercourse for months even after getting married, right? So if you're experiencing this problem, trust me, many people have gone through it. It's not a crime for you to experience it, and you shouldn't be shy about it. Speak up, go see a doctor, work together with your partner to fix it. It's definitely something that is treatable. The next reason why you might be experiencing painful sexual intercourse is history of sexual abuse. Some people, they were probably raped in the past, right? Some people were molested in the past and all that, and it had a big effect on their psyche. So it affected them psychologically, and every time they think of sex, they just remember that painful experience of rape, how it was painful for them and all that, and they just attribute sex to pain. So even when intercourse is not painful, they are already anticipating pain, and in their head is painful, so therefore it is painful, right? So if you are going through that, right, you have to see a therapist, okay? See a psychologist today or a psychiatrist. It doesn't mean you are crazy, but it's something that needs to be dealt with. You need to be able to move past this phase. Trust me, it's easier said than done, but it's possible for you to get past it. A lot of people have been abused, right? But you can get past it, you can fight it, you can win, and you can start enjoying sexual intercourse again. Remember, you have to do this for your partner. Your partner was not involved in the sexual abuse that you had. Your partner does not know anything about this, so you need to make sure that both of you are enjoying sexual intercourse together. Again, sometimes some people are abused by their partners, which can be more difficult, right? I mean, if your abuser happens to be your husband or your partner or whatever, right, that can be more difficult to deal with. But there's nothing that psychotherapy cannot do. There's nothing that seeing a psychiatrist and psychologist cannot help, as long as you are willing to solve the problem. So make sure you see a doctor today. And the last but not the least is stress. So everyday stress, physical stress, emotional stress, anything stress, right? Stress could cause, so normally on normal day, stress takes a toll on your body, right? It just causes everything bad and nothing good. So basically, one of the things that stress can do is it can cause your pelvic floor muscles to tighten. So in response to this stress, your pelvic floor muscles will become tense. They will now become tight and everything, and it will make penetration painful, right? So that's part of the things that can make penetration painful for you. So you might want to think about this. Am I stressed? Is there something wrong with me? Am I worried about something? Those kind of things, right? If you are, try to do something to relax, hang out with friends, watch a movie, sleep. Sleep is a very good stress reliever, play some good music, just do something to relieve the stress, right? Let your partner know that, see, I'm stressed right now, I just need to work on this and I'll be fine very soon, right? Your partner needs to be supportive, your partner needs to understand you. But you yourself, the only way your partner can be supportive or understand you is being open. You need to be open about the problem. Tell your partner what the problem is, tell your partner what you are dealing with, and you notice that even your partner will help you to relax. Maybe he'll give you a nice massage or something, or take you out to dinner or something, right, to relieve the stress, and you feel better. and you'll be able to enjoy intercourse without pain. So these are just 5 reasons I mentioned. There are other reasons that could make you feel pain during sexual intercourse, right? So many other reasons which I can't talk about in this video, because then the video will go on for eternity. But these are 5 common reasons. So if you enjoyed watching this video so far, don't forget to click the like button, subscribe, and share with anyone else you think might need to see this. Remember, your sexual health is as important as your general health and well-being. See you next week.